Us right here, Daily Report. Catherine Simole is on the sign language docket. We'd be happy to get your feedback on our socials below your screens. The government, through the Ministry of Health, has today confirmed that indeed the country is grappling a serious shortage of the BCG vaccine, and plans are underway to procure 2.34 million doses by the end of January. However, the Ministry of Health and the Kenya Medical Supplies Authority, that is KEMSA, has refuted claims of stock out of the ARVs, saying the drugs are available. Elizabeth Atieno, our health reporter, begins our bulletin tonight.
Many newborns in the country are at risk of tuberculosis following the shortage of the BCG vaccines, a crisis confirmed by the Ministry of Health on Wednesday. The newborns will have to wait till the end of this month, when the government is expected to procure 2.34 million doses of the BCG vaccine. Thereafter, a catch-up campaign will be conducted to vaccinate children who have missed out on the crucial vaccination.
Well, what we have done in the meantime is to be able to redistribute from the low utilization facilities to the high volume facilities to be able to bridge that gap.
According to the Health Ministry, the scarcity has been attributed to the withdrawal of the 2024 Finance Bill, which derailed efforts to disburse 4.6 billion Kenya shillings allocated for the vaccines and immunization program in the 2024-2025 financial year.
As a result, when we placed our orders with UNICEF, because we buy our vaccines through UNICEF with the support of GOtv, then our submission of the resources to GOtv were delayed. That affected our supply chain pipeline, and that is why we had a shortage of BCG.
Equally, we're looking at sustainable solutions, as the questions has been raised with regards to BCG, to ensure that we are not having any shortages going forward.
However, the over 1.3 million Kenyans dependent on the antiretroviral drugs ARVs can breathe a sigh of relief, as the Kenya Medical Supplies Authority KEMSA maintains that there is no stock out of ARVs and that they are currently changing the regimen of use.
The only thing that was misunderstood is changing the regimen of use. So there was a change of the medicines that were being used. Specifically DTG, dolutegravir, was being used instead of protease inhibitor, Tanavir.
The Social Health Authority has so far collected more than 20 billion Kenya shillings from the health scheme, and since the three funds under SHA are designated, SHA Board, through its CEO Robert Ngasira, says it opened separate bank accounts to facilitate the collection of the 2.75% under SHIF, a separate account for the receipts and disbursement of money under Primary Healthcare Fund, and another account to facilitate the collection and disbursement of money under the Emergency Chronic and Critical Illness Fund. The monies are still with the respective banks and are being used to settle claims in the health facilities.
Today we run bank accounts in the shift bank accounts are distributed in 6 commercial banks regulated by Central Bank, and each of the other funds has an account in one bank. And then we have SHA, the organization, also running its own bank account.
Minutes after the press briefing at the Afya House building, some patients stormed the boardroom, decrying the sorry state of the Social Health Authority, especially the system hitches surrounding the new health scheme.
20 patients we have walked all the way from Kenyatta Hospital coming here for treatment. From last week, Wednesday, the systems are not working.
Some complications, nikakuja Kenyatta again. Nothing is going to happen unless SHA approviwe. Hawatakupatia usaidizi wowote, you won't get treated. Sasa nimetembea all the way from Kenyatta tukaenda mpaka pale SHA House.
In a rejoinder, the Kenyatta National Hospital has acknowledged that for 2 days there has been a disruption in patient care due to system downtime in the SHA platform. KNH now says the issue has since been resolved and that normal operations have resumed. Elizabeth Atieno, TV 47, Nairobi.